Now, apart from the cocci, we now have gram-positive bacilli. And this gram-positive bacilli, uh, one of the common thing we want to look at is the what we call Corynebacterium diphtheria. This is another dangerous bacteria if not watched or keenly looked at. It's normally club-shaped. When you observe through the microscope, is Chinese character. They produce toxin as a way of causing pathogenicity. This toxin require infecting beta phage, the lysogen, which is heated up by protein. So the localized is normally localized within the respiratory tract, where the toxin is produced and affects the epithelial cells within the respiratory tract region, causing what you call necrosis. Actually, the rotting of those epithelial cells, if I may put it blunt like that. So they produce this what you call pseudomembrane production. Then it causes the dead epithelial cells, then dead polymorphonuclear cells, and by so doing, causing what we call suffocation. I still remember of a child who died of this Corynebacterium diphtheria because of late treatment. This toxin they produce is very, very poisonous, and it affects the epithelial cells within the respiratory tract side, causing necrosis. And once that happens, it's because of the dead epithelial cells, the dead white blood cells, which from nuclear cell, which comes around. Combined into that, it affects the trachea, causing suffocation. And in most cases, a child will die of suffocation because of all these things I've talked about. Uh, this happens due to the presence of circulating antitoxin antibody, what we call diphtheria toxoid. I mean, we can we have what we call toxin. I mean, we have what we call vaccines that can be used for vaccination to immunize our children due to presence of circulating antitoxin antibody. We have diphtheria toxoid, tetanus toxoid, heat-killed protective pertussis DPT, I mean DTP, which gives a lasting immunity for a long time. But whenever you suspect this kind of disease, Corynebacterium diphtheria, which is a gram-positive bacilli or rod, you better start a patient on what you call penicillin treatment. That is how Corynebacterium diphtheria causes. The sore throat is seriously affected. The trachea, the throat is almost completely closed because of the inflammation. The epithelial cells have been inflamed. The toxin, that the blackening part of it, the toxin has now is causing necrosis. The cells are now, dying off, rotting, and because of the immune system also producing a lot of white blood cells in the name of fighting, more and more hypersensitivity happens, and the throat closes down, and the patient will die because of what we call suffocation. Another gram-positive bacilli of medical importance apart from Corynebacterium bacilli, we have Bacillus anthracis. Bacillus anthracis, in other words, anthrax bacillus, is non-motile, and it causes three types of clinical anthrax. cutaneous anthrax or malignant pustule, pulmonary anthrax or wool sorter's disease, and intestinal anthrax or virulent enteritis. And ideally, this is a bacteria of this is a bacteria of the that affect cows or animals, but we come in because of our association with these domestic animals, and therefore we can suffer from those three diseases: cutaneous anthrax or malignant pustule, pulmonary anthrax, wolf sorter's disease, and intestinal anthrax. Treatment normally what we call acquired immunity from once infected, or penicillin treatment. For prevention, those people, animals which have died of this kind of disease, you have to criminate them so that you destroy this bacteria completely. It's a very, very lethal bacteria and very contagious. So those people who come from pastoral areas, they may have experienced or heard about this story. Those are just sites, the cultures. Okay. Apart from that, we also have uh, Bacillus cereus and Bacillus subtilis, which are among the group of Bacilli. Then we still have Listeria monocytogenes. Okay. Uh, it may cause listeriosis. Treatment is still penicillin. I will not want to go much into that. And then we have what we call gram-negative cocci. Yeah. So you remember we talked about gram-positive cocci, where number one we talked about staphylococcus and streptococcus. Then we've talked about gram-positive bacilli or rods, where we've talked about Corynebacterium. We've talked about anthracis, bacillus anthracis. Then I've mentioned about Listeria, Bacillus subtilis, just in passing.